Welcome to It's Your Case, presented by vetct.com. I'm Heather, your radiologist on demand for this week. Today's example is a 1.5-year-old lab with left front limb lameness for about a month and a half. Be sure to perform a systematic evaluation of this case before you continue with this video. Now, I'll highlight some important findings for elbows in this case. Starting here on the left, I want to point out the location of the medial coronoid process, which is here. You'll note that it is sharply margined and it has some new bone formation on the edge. There is a small fissure noted here, which is radiolucent compared to the adjacent bone. Also noted on this view, you can see that there's new bone formation on the edges of the elbow, and in particular at this location, which is the medial epicondyle. Now, going back to your attention to the medial coronoid process, let's compare to the other side. On the right side, the medial coronoid process I'm tracing here is better defined. You can see that there's no fissure or fragmentation and that there's substantially less remodeling of the elbow joint. I do, however, see a small calcified feature adjacent to the medial epicondyle, as well as minor non-uniformity of the medial coronoid process. Let's shift our attention to the lateral views. This is the lateral view of the right elbow. You'll note that when we trace the radiographic joint space along the elbow, you can see that there's the impression of potentially a step here where the distance between the radius and the humerus is slightly different than the distance between the ulna and the humerus, creating what we call a step at the bottom of the joint. This can be difficult to assess and confirm radiographically, and even with CT, our assessment of this can be inaccurate. However, on the left side for this patient, it's perhaps a little more obvious. The step that we're referring to is in this region here, where we go from having a wider aspect of the joint space to a much more narrow joint space. Some other minor findings include sclerosis of the trochlear notch. So, taken together, these findings are consistent with bilateral elbow dysplasia, substantially more apparent on the left side, and especially of concern is, going back to the left elbow, is this medial coronoid process. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on the social media. We encourage case discussion, and we're more than happy to help.